Australia's opposition Labor Party is holding its 48th national conference where it's expected to maintain support for the offshore processing of asylum seekers. But on the sidelines of the conference, there's an art exhibition which rejects the policy. It depicts images of migrants in distress. The display has alarmed some party members but has helped reignite discussions over its controversial policy. Well, with me now is Paddy McLisky from the group Doctors for Refugees. Thank you so much for joining us this morning. We've been talking about the situation, especially in Nauru, for quite some time, but tell us what's the situation there now.
So we know that several children have been sick children have been brought off Nauru with their families recently due to sustained pressure from the Australian public, which is fantastic. However, there are still dozens of individuals who've been waiting months or even years for investigations or specialist services that are not available on Nauru. And this is really part of the inherent barriers which exist in the offshore system to good healthcare.
So what would be your advice? Because as we've been reporting, it is a controversial policy.
Yes, well, I certainly, I'm not a politician, I'm not here to give policy advice, but I would ask all of the Australian politicians to consider this Christmas when they're at home with their families that there are inherent barriers to healthcare, such as the geographical isolation offshore, a lack of local facilities, multiple care providers and some confusion as to the delegation there, also multiple levels of bureaucracy for transfers and a massive psychological illness load on these people. And if we don't make significant changes in the new year, how will these people ever get better care in 2019?
Are you hopeful, though, because we have been talking about this situation for many years now, and neither side, because especially, I guess, because it's not a popular policy, they haven't really been able to make any changes?
Well, that is true. I suppose I feel that the tide is shifting. News polls in the last year have shown that a majority of Australians do feel that getting people off Manus and Nauru is a good idea. As to what's to be done next, I'll leave that to the politicians. But for this small group of people that have been in this situation for 5 years, I think it's really time to give them the care that they need.
New Zealand has emerged as a possible solution. Do you think that is something that they could consider, or is that still very controversial?
I think it is a matter of some controversy, but certainly our group does feel that they should definitely be considering that option. It's very reasonable and very kind of New Zealand to continue to extend this offer to Australia. And I think given the situation we're in with a lack of options, we should consider everything on the table.
And what do you think, briefly, is the impact of this policy on Australia's standing in the world?
Well, we've certainly seen condemnation from international human rights groups and other bodies and various nations. I think that this may well go down as being the second great stain on our country's history after our treatment of the Indigenous people. So I think it's really had a very negative impact on Australia's reputation.
Paddy McLisky from Doctors for Refugees, thank you so much for joining us today.
Thank you, Mariko.